Hi, welcome to the next episode of The Pet Factor. I'm Dr. Jim Hosick.
And I'm Brittney.
Brittney, this week we're going to go into mammary tumors in cats and dogs.
Okay.
Before we do that, we've got some news stories we wanted to bring attention to people.
Yep.
And the big thing everyone's talking about is the coronavirus. So
Yes.
we're recording this in April here. So the biggest unknown right now is the potential for the coronavirus to affect cats and dogs.
Mm-hmm.
At this point, really no good information. Doesn't seem to be affecting them. But there is the big problem for veterinary medicine is the risk of shortfalls of supplies for us.
Yeah.
So people are buying up all these masks and gloves, and then if we need to order them, we're not able to get them.
Mm-hmm.
There's also been a disruption of the supply chain from China where a lot of our drugs come from.
Yeah.
So even though people aren't buying them, we're not able to get them in the supplies that we need to. So they're looking to see if they can find other ways we can get those medications. Regarding there's interactions with pets, the CDC and the World Health Organization says there's no evidence that companion animals can spread the COVID-19 virus.
Okay.
However, those who are sick with COVID-19 should avoid contact with animals is the current recommendation, just as they should with people, until more information is known about the virus. When possible, you should have another member of your household take care of the animals while you are sick. And if you must care for your pet or be around the animals you're sick, wash your hands before and after you interact with them and wear a face mask. And they do recommend a face mask for the people who are infected so they're not spreading it. If you're not infected, there's no reason for you to go around wearing a face mask or putting one on your pets like we showed that one time. At this time, they have identified one dog that belongs to a woman in Hong Kong who they believe is infected with the virus. He's tested a weak positive. But right now, no one really knows what that means. So basically, they've done a second test that was also weak positive. They sent it off to the World Organization for Animal Health. They don't know what weak positive means in this animal. It could mean that the dog is living with this woman who's got the virus. It inhales virus particles, and when they did the nasal swabs, they're picking up these secondary particles in the dog's nose. It could mean it's very weak, attenuated in the dog. It's not able to reproduce as well as it can.
And they're
so
specifically testing for the 19 version?
Right.
Okay.
So it's a Pomeranian. It does not have any symptoms of the virus, but it's quarantined, just like the owner.
How did they go to test it then?
Because the woman was sick, so they decided to test the dog. And who knows if these test kits even work well in dogs? If this is this weak positive, it's just a side effect of some other cross-reacting with some other virus that the dog has. Nobody knows. So for right now, dogs and cats seem to be safe, but just use the precautions with them like you would with other people. Okay.
All right, for our next one, we have an unlikely hero. So we had some cats trapped in a burning garage, and they were saved by a little pity. So while in South Australia, a family was fast asleep, chaos was erupted from their garage. It caught on fire.
Oh.
It was the family's Sapphire Bull Terrier named Stan. Yes, Stan. He started barking to alert the family of the fire. He helped save two cats that were trapped inside. Firefighters quickly responded, and they were able to help, free the last two that were in there. Everyone came out uninjured.
The cats were sleeping in the garage. The dog sent a fire, and
he started barking.
So he was doing this because he wanted to save the cats.
He was. He knew the cats were in there. They were his friend. Pits and kitties can be friends. But Stan is a true hero now. He's been proving his bravery. And it also proves that dog and cat stereotypes are utterly useless. Stan just helped break that stereotype.
Yeah.
While commonly thought of as more people-friendly breed, this pretty would have left no kitty behind. He saved the kitty cats and his family. So they were part of his family.
I've heard stories of this before where animals have actually, woken people up and have managed to save people, but I've never heard of them saving cats before. So
you know what? There was a video some years ago where a dog actually, there were kittens trapped underground and it was flooding. And the dog actually helped alert people and was digging, and the people came up and grabbed the kittens because they couldn't find mom around. So the dogs helped to rescue 4 little kittens that were pretty much drowning underground. So dogs are fabulous. They're great heroes.
Okay. All right. It's nice to see stories like that after these silly not silly, but after the coronavirus, serious coronavirus stories we're doing. All right, let's move on to our health topic, and we're talking about mammary tumors, which are equivalent to breast tumors in people. These affect the mammary glands along the dogs and cats, and dogs and cats have chains of mammary glands on either side. So there's usually 4 or 5 nipples on either side that are all kind of loosely connected. About 20% of the tumors in cats, so all tumors in cats, are mammary tumors. The incidence is about 1 in 400 cats will develop a mammary tumor.
Okay.
And probably the reason we don't see a lot more is because of spaying.
Yeah.
Typical cats can be about 10 to 12 years of age. This can affect male cats as well.
Yeah. And it can affect younger cats, too. We had a 9-month-old cat who had mammary tumors.
Yeah, and that's really rare, but it's going to be, and usually if the younger cats, they're going to be Siamese, or they're at much higher risk. So if we do see it in younger cats, those will probably have some Siamese blood in them.
Yeah.
It is the most common tumor of female dogs. About 1 in 500 female dogs will develop these tumors. Very, very rare in male dogs.
Okay.
In dogs, it's more common in the spaniels, the pointers, the poodles, dachshunds, German shepherds, and Yorkies. Okay. There's several types that we see. In dogs, most of the tumors are benign. They can be either adenomas or cystadenomas. And there's also a mixed tumor. That's a combination of those tissues that are most common in dogs. The malignant ones that affect dogs are going to be adenocarcinomas, cystadenocarcinomas. Just regular carcinomas are the most common malignant ones. The most serious one that we see is what's called an inflammatory carcinoma. They're rare, but those are very aggressive and have the poorest prognosis. Cats are mostly malignant. You're going to see the adenocarcinomas and cystadenocarcinomas. They don't typically get the mixed tumors in cats. So what we've found, and there's been numerous studies to back this up, is the younger you spay the animal, the greatly more decreases their risk of developing mammary tumors. So we recommend by 6 months of age. Yeah. A lot of shelters will do them even at 2 or 3 months. So if you spay a cat at less than 6 months of age, you've reduced their risk of mammary tumors by 91%. At 7 to 12 months, you reduce it by 86%. At 13 to 24 months, it's only reduced by 11%. Yeah. And if they spay them after 2 years of age, you really haven't reduced their risk at all. Yeah. Sometimes we'll use hormone supplementation to treat other problems. That can also increase their risk. With dogs, we see the same sort of thing. Less than 6 months, we got a decreased risk of about 95%. So that's a pretty significant reduction. Yeah. Between the first and second heats, you got an 80% reduction, and then after 2 years of age, again, no change. Now, in people who are become pregnant have a decreased risk of breast tumors. Pregnancy does not decrease breast tumor risk in dogs. So saying you're going to breed them because it's going to make it less likely, it's not the case. It will not make them more likely because obviously they've gone through at least one heat there. The clinical presentation is pretty obvious. You're going to see a swelling or a bump along the mammary chain. If it's metastasized to other parts of the body, we can see symptoms associated with that. The most common place it's going to metastasize to is the lungs, so you can be some coughing. But it can get to the bones, it can get to the brain. Seizures or lameness can be presenting complaints too. You can also have the localized tumors present ulcerations in the skin. You can have discharge from that area or even from the nipples. You can have enlarged local lymph nodes as well. The malignancy rate in cats is 90%. So the key in cats is detecting early and getting it to it early. We want to get these before they get to be an inch in diameter. So if they're less than 3/4 of an inch, usually they have a much better prognosis. 30 to 50% are malignant in dogs. And the most common places they spread are those lymph nodes and the lungs. So a lot of times before we do surgery on these animals, I like to get a chest x-ray as part of our workup. So our diagnosis, we're going to make sure we're not dealing with just an infected mammary gland, which can happen. There are other tumors that can occur in the skin that can maybe make it look like it's a mammary tumor because it's just in that area. You can get enlarged lymph nodes along there that can also do that. Inguinal hernias can sometimes be mistaken for mammary tumors. So that's a hernia that comes up right where the back legs meet the body. And so you can sometimes feel that. In some cats, the inguinal fat pad has been mistaken for a mammary tumor because those can get inflamed or irritated and get swollen and red. And you go, oh my gosh, it looks like a mammary tumor. And You look at it, and it's just the fat passed down. So sometimes those actually have to be removed if they're really severely affected. So we're going to do a full exam on them. We're going to look for any other symptoms. We're going to do x-rays, like I said, of the chest and the abdomen usually, just to look for any signs of metastasis. If we're suspicious it might not be a mammary tumor, we might do a fine needle aspirate, but the most definitive way to treat these and to diagnose them is with excisional biopsy. Mm-hmm. When we say excisional biopsy, we're trying to take the whole tumor out. Yeah. When we're dealing with cats, we're going to probably be as aggressive as we can and do what's called a radical mastectomy. We'll remove the whole mammary chain on that side of their body that's affected. Dogs seem to do okay with just localized lumpectomies, especially since most of them are benign. But if you do see a couple of mammary glands affected on the same side, we're probably going to do the radical mastectomy on the dogs. And it's a pretty serious, aggressive surgery. And it can get kind of expensive for them. Additional tests, CT and MRI might be better at picking up metastases. So if you're not sure or you've got neurologic lesions, that's going to be the best way to look for those lesions in them. If the disease has spread, we may still recommend surgery just as a palliative care. Because if you got a big mammary mass that's ulcerated, that's oozing, it's a quality of life issue. You want to get that off them so that it's not causing problems. And they may still live 6 months or so with the problem with the disease going on. In dogs, if we can get at least about a 2 centimeter margin, a little less than an inch around there of normal tissue, we usually have curative results, even with the adenocarcinomas and the cystadenocarcinomas. In cats, typically they're going to recur. It's very rare that we just get curative results, even with the radical mastectomies, but sometimes we do. Spaying at the time of surgery, if they haven't already been spayed, it does not seem to increase survival times. Yeah. But it does prevent them from getting uterus infections in the future and other problems and going through more heat. So we usually will do it if the animal is stable enough for it. Chemotherapy has been shown to be helpful, but people are oftentimes scared of doing that because it can make the animal sick. Usually the doses we do don't tend to make them very sick, but if we look into, especially in a cat, or if the biopsy in a dog comes back malignant, if you want to make sure you're completely curative, then you're going to want to do that. Local radiation therapy has not been very effective. It might be for very small lesions or very localized lesions, so that's just something to talk with the oncologist about. Yeah. So the prognosis in cats is very much based on the tumor size. Yeah. So again, if they're less than 2 centimeters, they'll live 3 or more years disease-free. Nice. Is the average. So you get some that go longer. If the tumor is between 2 and 3 centimeters, you got about a 1 to 2 year survival rate. And if the tumor is bigger than 3 centimeters, which is not much bigger, it's about double to triple the size of the smaller tumors, your survival time is only about 1.5 months. Oh. So by the time, if you can find those nodules when they're the size of a little pea or a sesame seed or something like that, that's the best time to deal with them, get them off. And so if your vet says, you know what, let's take this off, say yes, don't wait and watch it, because it's better to take off something small that can be treated. And even if it's not a mammary tumor, you've at least ruled that out. Like I said, with dogs, the benign ones, surgery is usually curative. It's not going to affect their life. Again, less than 3 centimeters have a better survival time if it's malignant. Bigger than that, it's very poor. And if a biopsy comes back as an inflammatory carcinoma, a very poor prognosis on those animals. Prevention, spay your pets. And you're going to talk about this in the tech later. Tips, but spaying these animals less than 6 months of age is very important. There's been some cases with neutering in dogs where they do want them to be neutered a little bit later for certain breeds. The bigger giant breeds, the sighthounds, there has been some evidence. But for the females, getting them spayed at 6 months of age prevents so many problems. It's the most important thing you can do for preventive health care, apart from the vaccines and the parasite preventatives. So if you feel a lump along your pet's body, their chest and their abdomen, get it checked out immediately. Don't wait. Don't wait till their checkup. Just get it checked out. If the vet says, oh, it's just a lipoma or it's a cyst, great. You can keep an eye on it then. But if they feel that it might be a mammary tumor, you're going to want to get in and get that surgically removed as soon as possible. All right, let's go on to our case of the week. Yeah. All right. So this is a interesting case, and it's still being worked up a little bit because we ended up This dog came in because it was limping on the right rear leg.
Okay.
So, and not so much limping, but just wasn't putting full weight on it, was dragging the toes when they walked. So I checked and did a neurologic exam where I had the dog stand up, I support their weight underneath their belly, and just flip their back toes over so they're standing on the top of their toes. And see, they should flip back to putting their foot flat on the floor right away. For Riley, the left foot was perfectly normal in the back, and the front feet were perfectly normal, but the right rear would flip it over. He didn't even know he was standing on the foot wrong. And we had him walking down the hall. You could see him dragging that toe as he was walking because the neurologic reflexes, what's called conscious proprioception, was not working well for him. So I did some checks to see how his joints felt. There's no sign of a cruciate injury. The hips were pretty much intact. We tried to get some x-rays. Didn't get some really good x-rays, but did see some arthritis along there. So we sent him out for a referral. Owner is very interested in getting him worked up. She's had other dogs with cancer before. She's got pet insurance for Riley. And what they found was that he actually had some lytic lesions or areas of the spinal cord that were being eaten away by a tumor. And there were spots in the lungs, too, that could be metastatic lesions. So we're waiting to see what happens with Riley. I remember I had a dog with what was called a multiple myeloma, which is the most common tumor of the vertebrae in dogs. And they actually had surgery done on the dog's neck. And this was a mean little dog, had to sedated to do nail trims, and the dog did really well.
Of course it did. Of course it did.
So they gave the dog maybe 6 to 9 months. That dog lived another 3 years and did really well. So we got our fingers crossed for Riley.
Yes.
But you have to be aware that limping or especially dragging the foot, and especially if it's one-sided, can be a problem with that. We can see some bilateral disease that can be associated with degenerative disease or a disc lesion. Disc lesions can respond well to cortisone and rest. Degenerative diseases are less of a good prognosis, but it's not as bad usually or quickly developing as the cancers can be. So just want to make people aware of the fact that have your veterinarian do a thorough neurological exam, orthopedic exam. X-rays are very important. But when our diagnostic limits are reached, the referral places, especially with the CT scans and MRIs, are so much better at picking up these spinal cord lesions. So even if there's a lesion on the spinal cord, sometimes the vertebrae look absolutely normal, but unless you do a contrast study, you're not going to pick up those masses. And you have to be able to do that, especially if you're going to go in and do surgery on them. The surgeon needs to know where to do the surgery.
This is where that pet insurance really comes into play.
Right.
Because, you won't say no to a referral if you've got your pet covered on insurance.
And you get a relatively young dog, and the surgery's, it's a tough surgery, but if they can have a good recovery and can go on for another few years, a lot of times it's worth it. All right.
Yep.
Tech tip. So what I wanted to talk about is because of the mammary tumor thing is some other reasons why people should get their animals spayed neutered. Because I'm going to go in there and I'm going to say it's because it prevents mammary tumors. But there's actually a lot of other good reasons to get them spayed and neutered. They have nothing to do with that. So I figured you'd be a good perspective on that.
Yes. So getting your pet spayed and neutered, one thing is just the overpopulation anyway. Like most people, they say I'm going to leave my dogs intact because I plan on breeding them. If you plan on breeding your dog, first of all, you got to make sure that your pet is up to date on health and everything. Like you don't want to breed, and as much as I hate to say it, you don't want to produce a bad product. And that is one thing that we do see a lot of. If you have a shepherd comes in and he's got horrible hip dysplasia, and you plan on breeding him, his puppies are going to have horrible hip dysplasia. So you're just going to keep breeding, bad genetic health issues. So you have to make sure your pets are good for that. And a lot of times, most pets are not.
Right.
And then again, it's just the overpopulation. A lot of times, most pets that are bred through backyard breeders end up in shelters. And that's why these shelters are overpopulated, and a lot of the breeds that you do see on adoption websites or at adoption events are going to be dogs that were bred in someone's backyard, unfortunately. Or a lot of the puppies, your dog gets out of the house or something, especially these intact animals, their instinct is to go out and breed. And so if you leave an intact animal in the yard, what is their first instinct going to do? to get out of the yard and find another intact animal.
Jump the fence. And I think I told a story before about the St. Bernard that jumped through the picture window in the family's house. Crazy. Yeah,
it's crazy. And, you know, a lot of people, you know, especially a female dog, they get out, they come back home, and owners will think, oh, they're lucky, until, you know, 3 months later, there are puppies in your kittens or in your kitchen. And, you know, most people, you know, don't think about these things. And, you know, now you have, you know, 6 or 8 puppies. Now you have to find homes for them, and you have to care for them, literally, for 8 puppies to have to sit there and care for them. And then if something happens to mom, like most people don't think for breeding dogs, especially like, you know, a pug or a bulldog, or even like these large breeds, St. Bernards or Mastiffs, a lot of times you need to have a hospital prepared to have these puppies ready, because they have to have like a C-section. Because a lot of times most of these breeds cannot successfully have, you know, go through labor on their own. If your dog can, that's fabulous, but most of the time it's not going to be a purebred that can make it on their own. And then just some of the risks that comes with leaving your animal intact too, besides, you know, your pet getting out, you know, you have a chance of, you know, your dog getting out and maybe getting hit by a car, or if you have a younger dog, or not a younger dog, a smaller dog, depending on your area, there could be coyotes or, you know, birds of prey or things like that. You know, you can have your little intact Yorkie get snatched up because he's out looking for another female, and that's what happens. But it also helps with behavioral things as well. A lot of time behavioral issues are fixed when you know, spay and neuter before 6 months.
We just had a poodle in a couple weeks ago. The owner, the 2 intact poodles were fighting, and this one was instigating problems. She said, well, I need to get them fixed. And so he'll stop doing that.
Well, we had and this was a few years ago, we had a lady with 2 golden retrievers, and they were father and son. And of course they're intact, and they start attacking each other. And you know why that's happening, and that's because that testosterone. The son is trying to overthrow dad now. And unfortunately, dad's, you know, older, a little weaker now, but you have 200-pound golden retrievers in your house. Mom's getting hurt, dad's getting hurt. We're seeing these dogs every week because one of them's limping or have bite wounds. And these are things where he's like, you know what? I know you're happy you have the son, but he shouldn't have happened. You know, dad should have been neutered at a younger age. And mom kept asking, well, what do I do? And we had to tell her, you know, ma'am, you have to neuter your dogs. This is going to keep happening, or you're going to have to rehome them, especially because they're going to keep fighting. And again, this is how dogs end up in shelters. You have 2 intact animals. They start fighting or aggression issues. They end up in shelters, or they end up being put down or something because of aggression issues. You know, it's just spaying your females. A lot of times people don't think that, you know, a female dog can be as aggressive as they can when they are intact. But a lot of times, I mean, you ever dealt with an angry woman? So like, we are intact, and it's kind of the same thing. You're going to get that attitude. You're going to get a little aggression, and especially when they're going through like their heat, they get, you know, protective. They start, you know, making little nesting areas, and a lot of times we have seen people get nipped at or something because they went to move the nesting area, and a dog is protecting that site. So it's just a lot of behavioral things that could be prevented if, you know, we were spayed or neutered. And then a lot of times, you know, females too, you don't want to have to go through those heat and seeing little bloody spots all over the house. That's really nasty.
It is. And, you know, people say, oh, I think I'll wait. And then the first time the dog comes in the heat, can we get him spayed now?
Can we get a spayed?
No, we have to wait.
Well, and then that's another thing. You know, a lot of times they go into heat and they immediately come to the hospital and say, can they get spayed now? That is such a risk for us to put a dog in heat under, and then that's so much blood loss because you have to think they are in heat. The uterus is inflamed. There's so much blood going down there. That is such a risk for us to take, and then even for the pet.
Well, we had that one puppy a couple weeks ago. His platelets had decreased very much from the heat.
Yep, her platelets had gone down.
And when we tried to get the blood sample for the pre-anesthetic, it wouldn't stop.
She wouldn't stop bleeding.
And when it came back 2 weeks later, the blood count was back to normal. We were able to get the spay done. The uterus was shrunk down to a decent size where I could work on it. But you know, you put your dog at serious risk by doing that.
And yeah, just spaying and neuter. That's one of the first things most pets, get done when they're in shelters. And there's a reason for that. And that's just, again, the overpopulation of it. You see these animals in shelters. You see the pictures. You see the commercials and things like that. Why would you want to bring more animals into that situation? Especially if, reputable breeders, again, they breed for, and I hate to use that word, better products. So better quality.
Right.
You want to make sure you're breeding out health issues, so bad hearts, bad hips, bad joints, things like that, bad teeth.
There's a lot of work that goes into selecting the mates. There's a lot of work. And making sure that they are good, healthy dogs, and they're trying to work on getting a lot of these genetic diseases out of them.
And then just breeding anything is
and
not
they
good.
And they have homes for the dogs that they're breeding. So usually, before they've even bred the dog, they know 8 people that want puppies.
They're on a list of people, they say, I want a puppy, I want a male when you breed your dog. And, if you just have a dog and you just say, hey, I have 8 puppies, who wants to get a puppy? You're A, not knowing where these dogs are going. B, don't know what you're giving these people, because if you have a sick dog, these people could come back at you and say, hey, you gave me a sick dog. And see, again, just that overpopulation. You don't know what these people are going to do with these dogs. You don't know if they're going to end up in a dog fighting ring. You don't know if these people are just going to go out and try to breed these dogs for more money. And I don't think people realize that, when you're breeding your dogs, you're not in it for the money. Because, again, how much work and time you have to put into them is not worth it. And then, again, a lot of times, if you can't find homes for them, now what are you going to do? You're going to take your 5 or 6 puppies that didn't get adopted and take them to shelters or something. And that's how a lot of animals end up in shelters, because people breed them, can't find them homes, and they just drop them off, and they still never think to spay or neuter mom and dad.
All right. So, a lot of good health reasons, but there's a lot of other reasons to get those animals spayed, neutered by 6 months of age. And if you're worried about doing it that young, if you got a big giant breed male dog, talk to your vet, find out what their recommendation is. But the females, there's absolutely no reason to let them go through heat at all, because it does increase their risk of these problems going forward.
Yeah, I know a lot of owners, we do have some people who have reluctance just because they're smaller, but they still go through the same issues as a big dog would.
Yeah. Oh, yeah.
These teacup poodles and
They're
Yorkies, just because they're 2
species,
pounds. Yeah, they still have the same things going on. They need to be spayed. They need to be neutered. It's going to be health issues.
Okay. Well, just wanted to remind people, if you're watching us on YouTube, to go ahead and subscribe to our channel, and click on the notification bell so you get notified whenever we put up our podcast every week. And I also want to tell people we're going to have a special St. Patrick's Day episode with Monica again. So we'll be putting that out next Tuesday, I think, is St. Patrick's Day.
Yes.
And then our next health topic, we're going to talk about chronic kidney failure in pets. And then we talked a little bit about it indirectly with blood testing and some of the drugs that are associated, or toxins that are exposed with kidney failure, and some of the testing we have. But we're going to put it all together for people. It is something we see very commonly in cats, and we do see in dogs as well. So we're going to fill you in on all that. So that's it for this week. I'm Dr. Jim Hosek. We'll see you next time.